Good day everyone, my name is Extremities a first-year nursing college student that will perform a return demo about the upper extremities. Before starting the procedure, always introduce yourself first to the client, explain what are you going to do, why is it necessary, and how can she participate. So good day ma'am, my name is Extremities and I'm your student nurse for today. Today we will be examining your upper extremities. Perform hand hygiene before starting the procedure and touching your patient. I am providing my client privacy so she will not feel embarrassed during our examination. Procedures. Have your client sit on the examination table or on the bed. Expose the upper right and left extremities. Inspect the skin for color, tone, presence of lesions, muscles, and texture. Inspect the extremities for all deformities. Now palpate the landmarks starting from the clavicle, the acromyoclavicular joint, the coracoid processes, the bicipital groove, the biceps and the triceps, the epitrochlear nodes, the brachial pulse, the medial and the ulnar lateral epicondyles, the olecranon, the cubital fossa, the radial and ulnar styloids, carpus, the metacarpophalangeal joints, the proximal interphalangeal joints, and the distal interphalangeal joints. Now, we have to check the range of motion of the client by simply asking her to follow your steps. So, please ma'am, follow my steps. First is, place the arm on your lap for the pronation. Next is move the arms all the way above the head. This is for extension. Move the arms down all the way to the back, hyperextension. Move the arms to the lateral aspect of the body. Then move up above the head for the adduction. And then back down across the chest. For the abduction, place the arm with the elbows flexed behind the head for the external rotation. And next is move them behind the lower back for the internal rotation. Next is check the range of motion against resistance by simply asking your client again to resist against your strength. First is, can you please lift your hands on the side? And please resist as I push and pull. Next is keeping the elbows in a flexed position and then hands and fists and close to the chest. And again, ask your client to resist against your resistance. Next is, ask the client to keep the elbows to the side and down in the pronated position. And again, ask your client to resist against your resistance. Next is keeping the wrist in an upward position. Ask the client to resist as you pull them down. Please resist against your resistance. With elbows still on the side, ask the client to pull the hands in radial, deviation, and out for ulnar deviation. Next is, ask the client to spread the finger on both hands and to resist against resistance as I pull your fingers together. Next is, check the nail bed's capillary refill. Check the strength of the hands by asking the client to squeeze your fingers. Can you please squeeze my fingers? Now, the procedures are done. Document everything that you have done on your worksheet. And as I can see, my client has a normal upper extremity.